The following video contains information regarding the PICC line your healthcare provider has ordered for you. Brought to you by Parkview Health's Vascular Access Services. PICC stands for Peripherally Inserted Central Catheter. It is a small, flexible tube that is inserted in a large vein in your upper arm and gently threaded into the superior vena cava, a large vein above your heart. PICCs can be used for all your IV needs and to draw blood. A PICC will help reduce the number of needle sticks while you are a patient, and your IV treatment will become more comfortable and reliable. Your PICC will be placed at your bedside and will take about an hour. Your options for IV access are to continue with a standard short IV, but this will need to be changed every few days. Another option is to have a doctor place a line directly in a vein in your chest or neck. As a patient, you always have a choice, but your healthcare provider has decided that a PICC would be in your best interest. Generally, PICC insertions go well, but occasionally we can encounter difficulties. Most are minor and can be easily resolved at the bedside. Malposition can show up on an X-ray. If the PICC is not where it should be, it can be repositioned without any further needle sticks. Infection can be a problem for all IV lines. We use chlorhexidine to cleanse your skin during insertion of your PICC and take every precaution to prevent infections. Staff will clean all of your IV ports with antiseptic scrub and allow them to dry before use. Despite all efforts, infections can happen. A blood clot is another slight risk. Because the PICC is a tube that occupies space inside your vein, it has a possibility of causing a blood clot to form. We watch daily for any signs of complications and can treat you if these arise. Because the PICC is a very thin tube, it has a potential for blockage to form. A blockage in the tubing can be treated easily at the bedside. Having your PICC line put in. This animation shows how a PICC line is put in. A PICC line is a long, thin, flexible tube which is inserted in one of the large veins of the arm above the bend of the elbow. It is used to give intravenous fluids and medicines like antibiotics, chemotherapy, and nutrition. It can also be used to take blood. Having a PICC line means you don't have to have repeated injections or needles. Once it's been put in, it can stay in for weeks or months. It stays in until all your treatment is over. The PICC line is put in by a specialist nurse or doctor in the hospital. First, the area is cleaned with an antiseptic solution. Then the area is numbed with an injection. This is so you don't feel pain while the PICC line is being put in. When the skin is completely numb, a needle is inserted into a large vein in your arm. This will be a vein that leads to your heart. The PICC line is threaded through the needle and into the vein. The PICC is gently advanced through the vein toward the heart. The needle can then be removed, leaving the PICC line in place. At the end of the PICC line, there is a needleless connector. The nurses will use this for everything they give you through your PICC line and for taking blood. The PICC line will be held securely in place by a see-through dressing. Having a PICC line shouldn't hurt because of the local anesthetic, but it may be slightly uncomfortable and you may feel a bit of tugging. In some cases, a chest X-ray is needed to check that the end of the tube is in the correct position. Your treatment may continue after you leave the hospital, and if needed, the nurses will show you how to look after your PICC line before you go home. To make sure your PICC line doesn't fall out by accident and stays free of infection, it should always be covered by a dressing. If you have any questions about your PICC line, ask your doctor or nurse. What to expect at the bedside. PICC lines can be placed at the bedside. An ultrasound machine will be used to visualize your vein. Placing a PICC takes about an hour, and you can remain in your bed for the duration of the procedure. Your skin will be cleansed with an antiseptic solution called chlorhexidine. Maximum barrier precautions will be used to reduce your risk of infection. This means your PICC nurse will wear a hat, a mask, sterile gown, and gloves. Sterile towels will be used to cover your arm, and a large sterile drape will be used to cover your arm and body. A local anesthetic will be injected under your skin to help reduce discomfort during the procedure. You will not feel the PICC when it is threaded into your vein or into your chest. Your PICC can be used right away for treatment, but in some cases a chest x-ray may be needed to confirm placement. If we are unable to place the PICC, we will discuss other alternatives at that time. Your PICC will be covered with a sterile dressing and should be changed weekly and as needed. When you are ready, your nurse will have you sign a PICC consent form and will notify the vascular access nurse to proceed. If after viewing this video you have any questions, please ask to speak with your nurse, vascular access nurse, or your healthcare provider.